I am Gaurav Sinha on behalf of ICM. Today, actually, we are going to discuss with one of the eminent doctor here. And as all of you know, that dentistry is one of the major aspects in our life. Because as it is being said, कि दांत देर से आते हैं और जल्दी चले जाते हैं, इसीलिए इनको काफ़ी हार्ड कहा जाता है और पेन भी बहुत करते हैं. But at the same time, dentistry has progressed to an extent that now most of the conditions are being tackled very successfully, and the patients get a lot of relief from their problems. In the same process, now I have a Dr. Vikram Ahuja here with me, who is going to tell us something about himself and the dentistry. How can somebody improve his dental conditions also, and what are the possibilities of saving their teeth for a long time? So now, Dr. Vikram, you're most welcome to ICM.
Thank you so much, sir.
Doctor, just first of all, my question is, when did you start the dentistry?
Well, actually, it's 2004 I started my dentistry, and from there, I'm not stopping at all. And I think that I'm so passionate about my profession that it will go through and through. And I adapt new techniques. And now the things have totally changed, as you rightly said, that dentistry is progressing.
Yeah.
Yes, it is progressing, and we have amazing technology in dentistry.
That's right.
Like we have implants initially. I started my implantology in 2004. Until now, I have done more than 16,000 implant surgeries.
Amazing.
Which my name is in Limca World of Book Records in one of the initial full mouth rehab cases in which we did immediate implantology and loading immediately. Nowadays, we have a microscopic implantology.
Okay.
Yeah. So we have gone so precise, like when we do the implantology, we do bone checks through microscope, and if there is any fibrous tissue, we remove it immediately. Right. So that we can get 100% success in implantology. We try that. I won't say that it's a successful thing, but we have to try our best. Yeah, and after 3 months, when we do, if it is a conventional implant system, we do the placing the crown. There are now scanners, in which we get a precise crowns, and it's amazing these days, to get a teeth.
Yeah. How do you say the type of implantation or whatever the crowns you are saying? Are they patient friendly, and economically how are they placed? What is the cost factor comes in between? Can a general public also afford this?
Yes, of course. Why not? Well, in Cosmic Dental Clinic, we are doing in a very minimal cost. We don't charge so much of profits. So yes. A scanner is a one-time investment, and it doesn't matter how many scanning you do.
Right.
So there is no consumables in that. And when the scanning goes to the lab, of course the rate goes little higher, but not very high.
So you mean to say the general public can also afford the same?
Yes. In fact, we get patients from abroad, and I have been to US, UK, in which we see that in India, the things are very reasonable comparative to the foreign countries, and that is why the dental tourism is progressing.
Yeah, that's right.
Yeah.
So, as you know, that there are many categories in dental, orthodontics, periodontics, and other things. So, do you look after all types of patient, or you have got some specialty of your own?
Well, in Cosmic Dental Clinic, we have a different specialists who are looking after these branches. I do only implantology, and sometimes we do the general dentistry as well. So, but we are more into implantology. Sir.
Okay.
I am doing that. Yes.
Yeah. It's wonderful because it is not always possible. Everybody can do it, or it is successful also. Now, just to have something more initially. from where you did your MDS or BDS or qualification
Yeah.
part, and then came to this specialty?
So the thing is that I did my BDS from Lucknow.
Mm-hmm.
My initial qualification was Sardar Patel Dental College,
Right.
and then I went to UK. And in UK, I was being trained in Cardiff University, Royal College of England, and of course there I did so many courses there. And like I did my forensic odontology.
Okay.
Forensic odontology is the branch in which we investigate bite marks. That was my initial training in forensic, and still I do that. I have my book in forensic odontology. And then I came back to India. I started practicing implantology because I was being trained by Royal College, and Dr. Stuart Ottenden Jones was one of my trainer, and Dr. Eddie Sher, Dr. Ralph Roberts. They were the big names that time. Even they're the father of implantology. Like of course, Brandmark, we say that the father, but they were the parts which was being invented by these big teachers.
Big teachers.
Yeah, and after that, I did my oral medicine in MDS from Divya Jyoti Dental College, Meerut.
Okay.
Yeah, it's in Modi Nagar near Meerut.
Yeah.
So I did my MDS in oral medicine.
Okay.
And so that is why I have a multi-speciality training. Yeah.
So that makes that your horizon is very big, and all types of patients can come here and take the treatment out.
Yes.
So one thing more which is very common nowadays, they say that dentistry as a whole is now becoming very costly. It somehow this is a feeling, because they don't understand what are the complications going to behind it and what doctor has to do in it. But they say, "Bada महंगा है भाई." Something. This is what a common feature is.
Yeah, dentistry as a whole, yes, it is expensive, but in India, still it is very reasonable.
Right.
If you go to abroad, it is around 5 times more expensive what we pay here. You get a dentist very easily in India.
Yeah.
You know there is a news in UK where the common man is extracting their teeth with the help of an electric plier. So because they don't get dentists there.
Right.
So in Europe, there is so much shortage of dentists. We are lucky that we have so many dentists. And
I have heard that many
Yes.
people travel to India only to get their treatment done here.
Yeah.
Many from Australia also, and many England also, the people come here because it is economical. So this is all what we say is कि as you progress, as you do a lot of new researches, how painless this process is.
Well, I can say I cannot say that it is a total pain-free process.
Right.
Yes, there is a pain, but now the technology has improved. So yes, it is about now it is 5 to 10% discomfort is there. I won't
Because
say pain
dental pain has always been found to be very severe many times. So in fact, doctor, would you like to add something more for the general public to take care of their teeth, and what would you like to say about that?
Well, I can only say that it's my real important message to all my friends and the viewers that they should brush twice daily, and interdental brushing is very important.
Right.
If they are doing interdental brushing and massaging of the gums, you don't need a dentist. But the brushing should be in a proper technique. We don't want cavity. Cavity is there, the dentist role starts. Or if there is any swelling of the gums.
So doctor, at the same time, we would like to just know the new dentist doctors who are coming, what message would you like to give it to them for the benefit of the patients? That how they should behave and what should they do accordingly, so that they go satisfied without any burden or anything of the sort. What message would you like to give the newcomers?
Well, actually, I just want to wake my newcomer new dentist, because everybody requires training, and in dentistry, if you are trained, you can do everything.
Yeah.
So we shouldn't lose the war. I know there are so many dentists who are coming up, but we should make ourselves skilled, our hands, our fingers should be so good that we can treat the patient in a proper way.
Yeah.
So our training is really important. With time, experience comes. If they want to earn a lot of money, well, in medical branch, the money is, we shouldn't think about money. We should think about our profession.
Right.
And our skill is more important, and if they get a good skill, good training, they can do very well.
Actually, this is the crust of the thing. The skill has to be there.
Yes.
The knowledge and the wisdom is one thing, and then skill comes.
Yeah, books, yes.
Yes.
You just read books,
You
but
read books.
unless you don't do anything,
Right.
You won't get
And
the
that's
things,
what is
you know.
missing to a certain extent, to some extent, that people are just taking it as it is from the books and starting the practice without developing certain skills in them.
Because I have, in fact, I'll tell about myself.
Right.
I've spent so much of time of my life in training, that is why we are doing around implant trainings from 2010,
Right.
and still I'm training the dentist. We don't charge so much fees for those trainings. I want my profession should develop.
Right.
People should come out and they should do their work properly.
Sure.
Yeah.
So that's the thing which you want to know, because I have seen myself also in the market that every day or some in a month, lot of clinics are being opened, and they just start by setting up the system and they start doing it.
Yeah.
So, but as you rightly said, they have to use their fingers skillfully. That's the main thing.
Yeah, that is important.
That's
actually,
important.
yes.
So, this is Dr. Vikram Ahuja. Now, he has been talking about the dentistry and the various aspects of dental treatment. We would only say that let people come out of it, don't hesitate, take care of the doctor, doctor will take care of your teeth. The only thing is that, as he suggested, brush your teeth and keep yourself clean. Thank you very much, Dr. Vikram,
Thank you so much.
for giving us time and a wonderful information to our public. Thank you so much.
Thank you, sir.